Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you with a weekly podcast. I have a special treat for you today, special guest, Ernie Dickson, lifelong friend, and we work together. Ernie's been a physical therapist for 35 years, trained at one of the best physical therapy schools in the country, Northwestern in Chicago. So we work a lot together because we're both into fitness and health, extending your health span, and anybody that gets our age, we're the same age, gets hurt. They tweak stuff, especially if you're kind of athletic or you work out, even if you just walk, like we do a lot of mall walking now, bad weather. But in any event, we do a lot of things with PT in our office because we send them to Ernie and he cures them. He's one of those healing type individuals that is really knowledgeable and really helps a whole lot of people out. And the reason I wanted to get Ernie on here today and talk about stretching, the benefits and the controversies of stretching, is because I was at a health fair about a month ago, and I noticed in one section of that they had these guys from something called Stretch Labs. And that's a nationwide franchise that what they do, you just go in there and you get stretched out. So it really picked my interest up a little bit because I thought it was a pretty good idea. So I started taking a deep dive on stretching because it turns out it's kind of controversial. So I wanted to get Ernie on here to kind of discuss it a little bit. And really at the end, when we talk about it, we have a very similar thoughts about how you should approach stretching, because you can really, if you don't do it right, you can do more harm than good. So it's really interesting. So the benefits of stretching. If you look under the Mayo Clinic guidelines, they talk about stretching as improving performance in physical activities, decrease your risk of injuries, help joints move through a full range of motion, increase muscle blood flow, enable your muscles to work more efficiently. And I love to stretch. The main reason I like stretching is because it makes me feel good. As you get older, your muscles get stiff, and that's really the main reason I stretch, is to prevent stiffness. And I hope it helps me. I'm probably going to change a little bit of the way I do it after doing all the research and talking to Ernie, but because I have kind of poor posture, and I think it helps my posture. It definitely helps me to relax. It really stimulates that parasympathetic nervous system that we all need for our nervous systems to relax. That's the nervous system that keeps your heart rate going when you're sleeping, helps you digest your food. So you really need to think about your parasympathetic nervous system as well as your sympathetic nervous system, what gets you going. But anyway, so I had a few questions, and we're going to talk to Ernie in a second about this, but like, how long do you hold a stretch? When's the best time of day to stretch? What do you watch out for? If you overstretch, you're going to tear some things, those micro tears that may make it worse. So can you overstretch? Definitely you can. So stretching is very controversial. The more I researched it, the more confused I got, and that's why I got Ernie here to kind of clear some things up for me, because if there's anybody that knows about it, it's him. So a lot of experts think that stretching weakens muscles, doesn't prevent injury, and actually worsens performance in athletics. When you stretch before your activity, you're probably weakening that muscle, and you may have a worse performance than if you didn't stretch, depending on how you stretched, i.e. the studies on hamstrings. So it turns out there's different types of stretching, three main types. Static stretch, where you just bend and touch your toes and hold, that type of stretching. Static, probably not the best. Dynamic, better. That's moving your muscle through a range of motion. Especially a lot of athletes, you'll see them doing this on the football field. They're kind of recreating those motions they're gonna do on the football field. A ballistic stretch is a particular type of dynamic stretching where you're really overloading, you're overdoing, like really jumping high, and that can be a dangerous thing. It can be good, but more bad for normal people, average people. The best form is probably called PNF, something Ernie was very familiar with. I was new to this, but it's called proprioceptive neuromuscular facilitation. And this poses a load on a muscle that is already stretched in a shortened position. Ernie will tell you about it. And then rapidly relaxing the muscle through an opposite move. In other words, you're going to have somebody that knows what they're doing helping you with this kind of stretch. So it stretches the muscle even further than you think you could stretch it. It's very effective when you do it right, but you have to know what you're doing. And you really have to work with somebody like Ernie to do it right. He'll tell you why. So I've also heard other things like never stretch a cold muscle. Flexibility is not the same thing as mobility. And I want to know the difference. So contrary to popular belief, stretching does not prevent muscle soreness. That surprised me after a workout. In fact, it may increase your soreness. So what should you do? You know, it's still important. I'm a big believer in stretching. So what do you do after a workout to improve your flexibility and decrease tightness? So I think you need to do it, but there's certain things that you probably don't want to do. You probably want to breathe during stretching. You don't want to stretch through too much pain and all. So, and I personally use a lot of flex bands with my stretching and my workouts, really. I don't do a lot of heavy free weights anymore because I'm 68 years old. It's kind of tough when you're that old. And I also try to combine your stretching with strength training. Ernie, tell me a little bit about some of the things. You know, these stretch labs are everywhere. Right. You know, what's your philosophy on some of the stretching? What are some of the things that you know and some of the controversies about stretching?
It's like you said, if you read the literature, there's a lot of different opinions about it. I think stretching overall is good for most all of us, because we all, our lifestyles, the things we do, we tend to be creatures of habit. We do the same activities day in and day out. And, especially the more we age, the more the certain muscle groups tend to tighten up. And then if you have loss of range of motion, then you start having some joint issues sometimes, as well as pain. You have muscle spasms and that type of thing. So you want to, I think stretching is important, but there's different ways to go about it, and each person is a little bit different. And you kind of want to evaluate that patient individually and see what might be causing it. It's just like if you have diabetes, what's the cause of it? Is it lifestyle? Is it what you eat? Lack of exercise? Just not knowing really what to do, that kind of thing. The same thing with stretching. Most of us tend to work at jobs that maybe are a little bit more sedentary than they were years ago. If you're at the computer, that type of thing. So we tend to be in those static positions all day.
Forward bending,
so we tend to get a lot of tightness in the neck and low back, the hip flexors, hamstrings are tight. And then if you go home, you sit on the couch, you're still in the shortened position. You don't use it. If you don't use it, you lose it. But over time, we start to lose that mobility if we don't use it. And we're kind of creatures of habit. If we don't hurt, we don't have any discomfort, most people just don't have any motivation. They just kind of get into a routine. They're okay. Usually when I see them, or you probably see them, they're coming to you because they're hurting or something doesn't feel right. And so that's when you find out, hey, they've got a loss of range of motion. The stretching keeps the joint healthy too, because muscles cross joints. And so if the joint, if the muscle's tight, the joint's not going to go through its normal motion. So that contributes to degenerative things in the joint sometimes. If a joint doesn't have its normal mobility, the hip joint's a great example. If your hip flexors are really tight or hamstrings are real tight, then that joint is only going through a restricted motion, so you tend to wear that part of the joint out a little bit faster. So
you need to evaluate your joints as well as your muscles and ligaments and tendons, because you can stretch those, but if you've got a joint that's kind of off a little bit, or maybe even degenerated a little bit, you've got to approach it from a little different perspective.
Or a good example is say your calf muscles. Most people, we tend to have tight gastrocsoleus muscles in the calf, and so we stretch those, but a lot of times some people say, I just can't get my calves to stretch out, and they can stretch and do everything, but it may be the talocrural joint, which is the joint at the ankle, is the one that allows our foot to dorsiflex and plantar flex. And of course, the calf muscles plantar flex your foot. So you have a tendency not to have as much mobility when you dorsiflex the foot. So that joint has to move through the range. So a lot of times you can stretch, but people will say, you know, I still can't get the flexibility in that, you know, in that muscle group. So you mobilize the joint posteriorly, and that allows, that's the way the joint has to move to go into dorsiflexion. So, you know, that's part of the, you know, part of it too. So it's not, you know, they all three go together. Your flexibility, your strength, your joint mobility, all of that contributes to your overall flexibility in there. So you kind of look at it from that thing. You know, a lot of times, you know, stretching is good, but it's just one component of everything else that goes along with it too.
You're right when you say that people come to you when they're hurting.
Yeah.
You know, and you can help them, and you do every day. But wouldn't it be nice if we could kind of prevent some things like that? And I guess that's the idea behind the stretch labs.
Right.
Maybe just going in on a routine basis. But, you know, it'd be nice if people would, say, come into you for just a joint and flexibility evaluation.
Right.
And you can kind of see where they're at right now,
Sure.
and maybe prevent some things in the future. But I like the way you talk about this, because you know, you think about all the problems people have that I've certainly had, being this old and being fairly active in my life and still wanting to be very active and age well. You know, I've had rotator cuff problems, like who hasn't that's lifted weights and done things like that. And it turns out we're in that forward position we're always in. We're strong up front in our pecs, but we're weak in our back muscles and our scapulas and subscapulas and rhomboids maybe. And so we tend to lean, you know, rotate forward, and it pulls on those rotator cuff muscles in the back of your shoulder and leads to joint problems. I've certainly had them, and I've sent many people for surgery for torn rotator cuffs. Same thing with the weak gluteus medius, you know, the top part of your butt muscles that are so weak, even in people that do a lot of squats and, you know, heavy weightlifters.
I see a lot of runners and things.
And a lot of runners, and that leads to, you know, your tensor fascia lata being tight, and then your IT band. Then you're going to have knee problems. I mean, this stuff sounds complex, and it really kind of is. You know, if you don't know somebody like Ernie that can really isolate the problem. And I really loved what you said about not only prevention, but really, why are you so tight? When somebody comes in, you know, we know you're tight. You have tight hamstrings, you know, you've got tight pecs. Why though? What are you doing that's causing this? That's like, you know, functional medicine. That's what I do. Why do you have diabetes, like you said? Why is your cholesterol high? Why are you so overweight? Why are you tired? Why can't you sleep? You know, you got to figure out the why. Otherwise, as doctors, we're just prescribing medicines all day. We're not solving the problem. And you, as a physical therapist, you're seeing these people, they're coming in hurt, and you're helping them, you're fixing them. But wouldn't it be so much better if you could figure out why, so that they wouldn't keep coming back to you?
Right.
I think that's what's going to happen with these stretch labs.
Yeah.
They're really not going to figure out why, and they keep them coming back.
Yeah.
That's nothing against stretch labs. I think it's a good idea.
Yeah, it's a good idea.
But if they can get somebody like you and come in and figure out really why, and even look at the other things. You're not drinking enough water, you know, to really hydrate your joints. You're not sleeping in the correct position. I truly believe my back problems are caused over many years by poor sleep position. I'm convinced that's why I have scoliosis, and it's led to really tight iliopsoas muscles and iliacus and all, which I now have my hip hook for. But I'm certainly going to take a more proactive approach with me. You've helped me tremendously over the years with my back and my shoulder. I mean, you've worked on a lot of things on me that's really kept me going. But the bottom line on stretching, give me your bottom line. How do you think we should approach it as far as how long should we do a static stretch? Should you do those dynamics? Should you do the proprioceptive? Obviously, people should come to you if they're having problems, but give me some tips on, the bottom line on stretching? What's your idea about how we should approach this?
I think if you have a blend of stretching, there's a lot of research out there on different types of stretching, and it kind of depends on which study you look at, and some people try to say this is the best and this is all you need to do, but I think it's kind of a blend, and if you can find, it's just like the static versus dynamic. The dynamic is a great idea because it allows you to warm the muscle up a little bit and then to kind of warm it up, but then that only gets you so far, and then sometimes you need to do a little isolation and target really a specific muscle. It's just like your hamstrings. There's 3 hamstring muscles. For most people, the biceps femoris is probably the tightest of the hamstrings because it's the lateral hamstring, and it has, as far as the innervation, it has 2 innervations to it, so from the spinal nerve that comes out. So a lot of times when I check people, I check for lateral hamstring and medial hamstring. So, just depends on what you find, but usually there's one or the other. So you can isolate that specifically, and it's hard to do it dynamically because dynamically you're moving through a range, and that's good because it warms the muscle up. But if it was the lateral hamstring, the biceps femoris, you'd want to statically try to gently stretch that because it's the tighter one of the 3. Dynamically, you're probably not going to be able to reproduce it because it's more of an active motion and it's real quick. But I think it's good to do the dynamic because it warms up the muscle and you get blood flow in it, and it doesn't want to strain as easily. The static, you have to be careful because, especially athletes, we tend to like to feel something and we think, wow, that's a little bit, but if I go a little bit more, it's going to be better if I double it or triple it. So we go to the point of pain, and then it's almost too much. We actually strained it. So if you had a tight muscle, you want to gently stretch it, but you don't want to get into the pain zone. And a lot of times, a lot of people feel like if they don't get to the pain zone, they haven't done anything. And that's where you have to sort of tell them, don't go that far. It's more you're trying to get to the point where you get a gentle stretch, maybe 5 or 6 on a scale of 0 to 10, and hold it and just relax and breathe with it. Don't stretch in a hurry. A lot of times people tend to stretch as an afterthought. It's like, okay, I've got 30 minutes to work out. I'm going to do these stretches real quick, and because they don't really enjoy the stretching part of it, and so they rush through it or they push it a little bit too much, that kind of thing. But with the stretches, you can do some active stretches, which is you moving the muscle, just like if you were going to do a quad stretch actively, you'd just be standing, pulling your heel towards your buttock. That's an active stretch. An active assist stretch would be the same motion, but you might have a strap and give yourself a little overpressure. A passive stretch is more where you're taking your hand and bringing it through the range completely yourself. And then the PNF is kind of the proprioceptive neuromuscular facilitation. That's where you're kind of using there's a muscle spindle in every muscle, and it's kind of sensory nerve tissue fibers in that muscle, and it has a direct connection to the spinal cord. And it sends, like an impulse there, like, it's like a stretch reflex. When you check someone's reflexes, you check their patellar tendon reflex. When you hit them with a hammer there at the patellar tendon, that causes a stretch, and that sends a reflex to the spinal cord, and that sends a message to that muscle to contract, and you get that little bump when when the quad kicks out. But the PNF, what you're doing there is you take the muscle up to where you feel a stretch, and that's about as far as you can go. Then you do an isometric contraction of that muscle. So when you do the isometric contraction, that inhibits the antagonist muscle. So with the hamstrings, the antagonist muscle is the quad. So when you do the isometric contraction of the hamstring, it inhibits the quad. That allows you, then you relax and you go a little further. So you get to the end range on the passive part of it, and you think, well, that's as far as I can go. You have them do a submaximal isometric contraction, then gently move them into range, further. So you're using the PNF stretching, which is really good. That's what they do a lot in the stretch lab. But again, that's just one part of the puzzle with it. So you want to. The other part is the strength component. If certain muscles are weak, then you're going to be tight in other muscles because they're trying to overcompensate for you. So that's the cause of it. A lot of times if somebody has chronic tightness, you look at the antagonist muscle a lot of times because it may be causing. So it's kind of looking at the whole picture, and then and then looking at the joint, because the muscles cross joints, or they affect joints. So it's kind of the big picture. You want to just look at the whole big picture. It's kind of a biomechanical issue, really. But there's a lot of controversy. Some people say, don't do static stretching, only do dynamic, and so you can do the dynamic and it's good, but then you miss a little bit by not doing the static if you had a specific area. So the way I feel about it, I think you ought to do a little bit of both, and that way you get use the best of both worlds. And then, but with static, you don't want to overdo it and go too far. You can tear the muscle, that kind of thing. Using the PNF is a good thing. So you've got, it's like a toolbox. Use all three tools. You don't have to use just one tool.
With the PNF, you're going to need a physical therapist or somebody.
Yeah,
very
you need
knowledgeable.
somebody to help you with that, because you need to relax it, because you can't do it by yourself. But what I try to do is teach people so they know what to do at home, and then most of the time, you can work around it if you have someone to help you, or sometimes you can even do a PNF yourself if you can stabilize your, like say with the hamstring, if you've got a little area you can put your heel on it and then just move under it and stretch it, and then you can do an isometric yourself.
Kind of like you taught me to do with the bicep.
Yeah, right. So you can do that, and then just kind of look at, and then it's the patterns that we do too. That's sort of, it's just like if you have an office worker and they're working at the computer and they've got bad posture, well, they're going to have a lot of, their neck flexors are going to be tight, their hip flexors are tight. So every day they go to work, they're going to tighten up again. So they need to have a routine that they can do daily. They can't go to stretch like probably every day, because it would be so expensive. But if they know, okay, I'm tight in these groups, I need to do this. It's like brushing your teeth. You can't brush your teeth one time and make it last. The stretching is kind of a gentle routine. You don't have to spend a lot of time, but you need to have a routine. It's just like anything else, it's doing some, exercising is good, stretching is good. You just, just find a moderation, I think.
Wow, you're so knowledgeable about all this stuff. I'll learn a lot from you about like the medial part of the hamstring, the lateral part, what you're looking for, because it's complex stuff. The body is an amazing thing, but it's complicated.
It's a miracle. The good Lord, it's just amazing how the the neuromuscular system's just incredible, the way the spinal cord, all the sensory motor nerves, and it's just, the way everything's interrelated and it works so perfectly, we don't even have to think about it. But
we're given all the things we need. We just need to use them right.
Exactly.
And use somebody like you who can teach us about this stuff. But you're right. So many people, I think, have headaches because they're so tight here from the kind of scrunching over they're doing all day at work. And so many people have such bad low back problems because of the same thing. They're weak in the back part and their butt muscles, and they're over strong on their quads. It's a lot of it's just balance as well. And then when you get older, you better have good balance or you're going to fall, and that's going to affect your mortality.
And it's just a repetition. We're creatures of habit, and we tend to do the same patterns over and over. And we're all born with pretty good flexibility. And as far as like when you're a younger person, most of the time we have that flexibility, but we tend to get into patterns of movement that we don't do we do the same thing over and over. And then over time, our joints change a little bit, the muscle tissue, the fascia in our body changes. So, that's why you see someone when they're 20, and then you look at them when they're 80, well, they're usually over. And it's not because we had to go that way, it's just that gravity's pulling us that way, and we don't offset it going back the other way. We tend to just do our routine because we're fine, but then all of a sudden you look in the mirror and go, gosh, what happened? I'm way over this way, but it was happening over a long period of time, but it affects the joints, and it affects, you start having pain with it then. And that's always a motivator when people start having some
Then you
issues.
go to the doctor.
Yeah, then you go to the
I've
doctor.
always said people come to the doctor for one or two reasons. Either they're tired or they hurt. That's why people go to the doctor.
It's kind of the same thing with physical therapy. Usually you don't see anybody that feels good come in that's usually they're having an issue.
And they should. They really should.
Exactly.
You really should teach a stretch class, and you should really do some, just have people individually also come in, and you can evaluate their status and then teach them some things that they could do that would help them tremendously. As I get older, You know, I'm the same weight as I was in high school and college. You know, and I feel pretty good. The main thing that bothers me about aging is really the stiffness of the joints. That bothers me by far more than anything. And when I do tweak something, it takes so long to get it better.
Yeah.
So, you know, I like the way you approach things. You're really a functional physical therapist, really, when you start looking at the way you practice medicine.
So you try to treat what you find, and that's where everybody's a little different, you know. But if you can get kind of a good subjective of what they do and how, you know, what they do in the day and their issues in the past, and a lot of times it's a pattern. It's patterns of activity or movement or habits. And
their lifestyle, really,
yeah,
not
yeah.
only from what they eat, what they weigh. I mean, if you're obese, you're going to have a lot worse problem. I can't imagine me being 50 pounds heavier than this, how I would really hurt then and be stiff. I mean, but hydration, a lot of sleep, decreased stress. I mean, hormones also have a lot to do with that, believe it. Hormones may be one of the most important things in how your muscles and tendons are going to age. But I love the approach of prevention, asking why. Why do you have this? And then going from there and try to reverse some of the things, that the bad habits, whether it be a simple posture change, or the way you sleep, or the way you move, or getting up from your desk, taking breaks, you know, certain stretches. I'm a big believer in stretching.
Yeah.
You know, I know it's controversial, but I think you need all three types of stretching.
I do
And
too.
it's got to be a routine thing, like brushing your teeth, like you said. You just have to do it, or you're not going to age well.
Right. Yeah, it's kind of like, if you can just find a program that's doable for you, that's in moderation. It doesn't have to be extreme, you know, because if you can find a happy balance between all of those, you know, a lot of people try to say, well, this is the only way to do it, and this is the only way. But usually it's a balance of things, and then finding something that works for you. And the key is doing it, you know, because a lot of times if you get into a thing where you're just say, well, this is good, this is not, and then you kind of go back and forth. The main thing is do it. You know, it's kind of like the Nike commercial. Just do it.
Yeah.
You know, if you can get a routine going, and then find what works for you, and it's just a gentle discipline. Is what it is.
Yeah. You have to move.
Yeah.
You know, you have to move and put your joints through a range of motion. But you know, I like to observe things. When I go to the store, I like to observe people, like what they weigh.
Yeah.
But one of the things I look at is how they move. And when I see a lot of people, most of them at a certain age, maybe over 50, they shuffle, they're bent forward, and they're limping, and you just feel so sorry for them, and you want to go, what happened? How did you get that way?
Right.
Because you're not walking like a person's supposed to walk.
Right.
So anyway, this has been such a great conversation, and for the people out there that don't know Ernie Dickson, you should take advantage of this wealth of knowledge, and he's just so good with patience. You know, I should be a walking advertisement for you. But come see Ernie Dickson and think about stretching, the ways you stretch. You may be overdoing it. You may be doing more harm than good, because it is controversial, but you definitely need it. And maybe you need to come see Ernie. I know I'm going to keep going to him.
Thank you so much.
But thanks for coming on, Ernie.
I appreciate
So learn how to stretch. Know your body. Find out why you're so stiff. Well, this has been a great episode. I'm looking forward to many more conversations with Ernie. Of course, we talk every day about something. But anyway, I hope you enjoyed and learned a lot. This is Dr. Tom Rogers at Performance Medicine. See you next week.